So
You asked me about like long-term impacts on telehealth. I'm wondering, will this have positive long-term impacts on public health? And I was reminded of a comment that ED doctor at Kaiser here in Seattle said to me a while ago. But we've gotten to this point where we have often wildfires in the summer and really bad air quality. We had terrible air quality for the basically first 2 weeks of September this year. And what he said to me is he had no way of searching the EMR to find his patients that had asthma, to send them an email to say, do not exercise, do not go outside. And I'm just wondering, like, in trying to find these people who are qualifying for a COVID vaccine and doing this kind of search, will we get those kinds of capabilities? Like, he wanted to proactively reach out to his patients and he couldn't because he couldn't find them. So I'm hoping that this will, what do you think? Like, is this going to have long-term?
It'll absolutely have long-term impact on public health. I mean, we're already seeing just a bunch of conversations start to kick in of what information do we need. And when the pandemic started, we still had the massive bureaucracy on top of this thing. And people were just saying, look, we're in the middle of this thing. I don't have time to collect nonsense information that you need for this and this. Why don't you tell us exactly what you need? And that's what we're going to give you. And some people started working on what are the data fields we actually need in terms of the pandemic. And so the same way I'm talking about that is the same way I'm thinking about public health. I think people are going to step back and realize, first of all, I think we're going to define public health a little differently than we have before in the elements of things that we need in order to be effective, and who are the players in public health. And I'll give you the one example, and this was a JP Morgan conference. This is a combination of JP Morgan conference and vaccine distribution. CVS has done close to 1 million COVID vaccinations already. And wow. They haven't done them in their stores. They got the contract or whatever to do them in long-term care facilities because they were close enough. They had the distribution mechanism and they had the healthcare system relationships. And so they took their clinics, they went out to these long-term care facilities, they took the vaccine with them, and they went to all these places. They did about 1 million. And they said the next step for us is, and to be honest with you, it's probably much more effective than some of the things we're trying to do today. And I think these are the kind of conversations we'll have. So they're going to go out, or the next step is the federal government will essentially make them a distributor of the vaccine. And they're just better at reaching people, right? CVS knows how to get a hold of me. The local health system doesn't know how to get a hold of me. I haven't been there. They don't even know I exist in this market.